Confam is a pharmacist as well as a diabetes educator, so we sought her out to help us work with a population set for diabetes. Jeremy walked in the door with a piece of paper and from his physician, and he asked, "Can you take my insurance? My doctor wanted me to come here to learn about diabetes. You take my insurance?" I said, "Sure, come on in. Let me get your blood work. Let me get your release form so I can get the blood work from your doctor." I seen him walk in the door. I know he needed the help. He said, "I really am looking for somebody to help me because nobody could help me lose weight and get my diabetes under control." And I knew he would be a success story because I can see it.
First, we did a lot of education regarding diet and exercise. I remember you showing me the label for the right kind and the wrong kind. Con is very motivating. I wouldn't say she's real hard on me, but she doesn't pull any punches. She's genuinely concerned for your health, and diabetes does come with a lot of risks, and she explained a lot of those risks to me and past of other patients she's worked with, so that helps motivate me to do better.
Diabetes is a preventable disease. If you mentioned about type 2 diabetes, is preventable, treatable. And the cost of healthcare right now is skyrocketing. And if we can prevent amputation, blindness, and even the cost of medication, to me, it's worth it. There's a lot of patients out there, diabetic patients, that don't fully understand what they need to do as a diabetic. They don't understand what food can do to them. They don't understand what their medication can do to them. And there's a lot of patients that are just suffering unneedlessly.
I got a lot of education, a lot of motivation, and having the good visits where they weigh you and do all that, and making progress motivates me to come in more. I've lost a lot of weight in a short amount of time. I went from a 44-inch waist to a 38-inch waist. I had to go buy all new clothes. Gave all my fat clothes to Salvation Army, so that was fun. And my A1C on my blood work went from 9.5 to 5.5, and I'm maintaining that level.
His physician cut his medication in half from doctor visit every 3 months, 6 months now, and from 253 pounds down to 204. To me, no money can buy that. No money can replace that. The look on his face, he walked in with dignity, and he looked so proud. He's almost like 20 feet taller in my eyes. We assisted her in review of patients, as well as setting up a database to track and trend the patient's progress, and to also help her build a business case to get this work out in the valley as well. Through your help and guidance, we were able to not only positively help the patient, but we were able to track the outcome. So to show how much of an impact pharmacists have on patient care. I would say the kindest thing you can do for your patient is refer them to someone. It doesn't have to be a pharmacist. It doesn't have to be a center. It could be any provider, any nurses, pharmacists, educator that provide education for your patients so they can do better. It's not about somebody stepping in and then take over. We don't do that. With all due respect, we help patients. We work together as a team.